Through reimagining PHC, we will build our national experience from fighting COVID-19, Ebola, polio, and many other health challenges to implement long overdue changes that will transform the way healthcare is delivered in Nigeria. It is an ambitious plan to work with a diverse group of domestic and international partners to construct a grassroots network of quality primary health care. Fixing our primary health care is the most cost-effective and realistic approach to saving and improving millions of lives. Hundreds of thousands of Nigerians die each year from treatable, preventable causes due to lack of adequate or accessible primary health care services. We need to end this. We need to begin making radical changes now. Here today, I want to lay out for you the top lines of how reimagining PHC plans to transform our nation's health. Working with states and local government areas, we will pool resources and commitments towards practical, high-impact interventions across all aspects of primary healthcare delivery. Traditionally, public health funding has targeted specific threats such as polio, malaria, or HIV/AIDS at the expense of a wide range of chronic illnesses and healthy well-being. The narrow approach to problem solving has led us to where we are now, with some of the worst, most tragic health statistics in the world. We need to work holistically. Secondly, we will invest in building up our failing primary healthcare system so that it can treat infectious diseases as well as address chronic illnesses, prevention, diagnosis, and referral. The NEMSA initiative of the Honorable Minister of Health to improve our ability to secure the life of people who attend the primary healthcare centers by ensuring they gain quick access to the next level of care through the NEMSA program is going to be very critical towards how we succeed. We will also focus on ensuring that maternal and child care is a priority, and we look at the preventive aspects of care, especially community wellness. This will mean investing in primary health care, human resources, and infrastructure across the country. We will restore health centers, ensure provision of general, laboratory, clinic, and personnel equipment, ensure the availability of quality drugs, procure ambulances for accessibility, and last but certainly not the least, we will train and employ quality nurses, midwives, clinical staff, and non-clinical staff at health centers across the nation, making sure that this is a bottom-up approach, working very closely with the sub-national level.
That this summit is one of the most important, perhaps the most important, of the Federal Ministry of Health's initiatives, because it is about universal health coverage, the foundation of community health and population health, and the cornerstone of the health agenda of the administration of President Muhammadu Buhari. It is to make a case for the minimum package of basic health care services available, accessible, and affordable to all citizens using a network of at least one primary health care, one functional primary health care center in every political ward. There are nearly 10,000 political wards in Nigeria. And yes, it is true that an audit of health facilities shows that we have about 30,000 structures to go as primary healthcare centers because it has been a favorite constituency program of many lawmakers. But most of them are not functionable, they are not functional, they are not usable. And it is 10,000, one in every ward we want to start with. They can expand later on beyond that. And what functionality is of a primary healthcare center has been redesigned and redefined by this administration. Taking care of 70% of the health needs increases the nation's health, happiness, productivity, and even the GDP. The PHC system is also the best platform for public health security in the area of surveillance, response, tracing, and tracking. Strengthening the PHC, therefore, automatically strengthens the secondary health care and the tertiary health care. We have recently redesigned the typical primary health care to include a staff quarter, to include water supply from the borehole or any other source, reliable electricity supply, preferably with renewable energy, solar, and a good complement of human resource for health and for stability of staff